This is a recording for my SE 502 class for the discussion board number 1 video reflection, and for the question to discuss perceptions of individuals who have articulation phonological disorders throughout the lifespan and how these perceptions change. It may be cute in preschool but will likely be made fun of in the upper grades. Why do perceptions change and how might this affect the individual? My answer to that choice is an articulation disorder and a phonological disorder can co-occur. It can occur in the same child. The perceptions change because older children need to be able to communicate with their peers, and not just their peers, but also with other people in general. It might affect the individual socially and emotionally, development, especially academically. A child has difficulty organizing their speech sounds into a system of sound contrast. Both disorders will require therapy or intervention. Students with articulation and phonological disorders need to be able to form a particular speech sound correctly. These perceptions can have a negative impact on students' social and emotional well-being. In addition, students with articulation and phonological disorders may be negatively impacted by their teachers' perceptions. In preschool, it is normal for a young child to not speak so correctly when actually because they're so young. And it can always be fixed through therapy or intervention, one-on-one talk, conversation. However, when they get older, that's when it becomes more of a problem because it's kind of hard to fix old habits. But it still can be fixed, but through its extensive and effective intervention and therapy. Many children with phonological disorders have deficiencies with articulate knowledge. Children who are less able to produce or approximate certain sounds because they have less articulation skills. Articulation disorder is a speech disorder that affects the phonemic level that is in charge of the brain work. The reason for this speech disorder may be known for such serious problems as muscle dysfunction or birth defect. It can be any type of defect, but most articulation phonological disorders, which is speech disorder, it's not a disability, but it can be fixed through therapy, effective intervention, extensive IEP plan, any kind of way that can be fixed to a child. And that is my answer, and my name is Chelsea Knowles, and that's my response.